Good evening, teacher and student. My name is Joseph Anthony Garcia Mera. I am going to talk to you about 5 years outcomes of gastric bypass in adolescents as compared with adults. Definitions. Gastric bypass is surgery that helps you lose weight by changing how your stomach and small intestines handle the food you eat. After the surgery, your stomach will be smaller. You will feel full with less food. However, whether outcomes differ according to the age of the patients at the time of surgery is unclear.
To access the abdominal cavity, small incisions are created. Trocars are placed to serve as passageways for surgical instruments. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes. These help break the food down into a simpler form so that it can be digested more easily and absorbed in the small bowel. During a gastric bypass, a small pouch is created in the stomach using a stapling device. The small stomach pouch, about the size of an egg, limits the amount of food you can eat before feeling full. The small bowel is separated into 2 sections. The lower portion of the small bowel is attached to the newly created stomach pouch. This allows food to pass directly into the second portion of small bowel, where digestion continues. The upper portion of the small bowel is reconnected to the lower. Bile and pancreatic fluids from the liver and pancreas allow food to be digested completely. By altering the anatomy of the gastrointestinal tract, gastric bypass changes signals in the body, resulting in decreased hunger and increased feelings of fullness after meals. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
Application in medicine. We evaluate the health effects of gastric bypass in adolescents cohort study, 161 patients, and adults cohort study, 396 patients. The 2 cohorts were participants and 2 relate but independent studies. Linear mixes and Poisson's mix models were used to compare outcomes with regard to weight and costing conditions between the cohorts 5 years after surgery. Pros. The rate of abdominal patients was significantly higher among adolescents than among adults, where there was no significant difference in percent weight change between adolescents.
Are not good. More than 1/3 of adults, or 78.6 million people, are obese. One way to combat obesity is to have gastric bypass surgery, something that more than 200,000 people have had. To talk more about this surgery, Dr. Steve Scott is here now from HJ Midwest Health. Thanks so much for coming in. First off, a new study came out and it kind of talked about the benefits that people have seen who have had this surgery. Tell me a little bit about that study.
Yeah, so this study comes from the Cleveland Clinic, a very reputable place. And the thing about this study is it tells us some things that we sort of confirmed and already knew, but it also gave us some new information, and that's always nice when a study does this. This study looked specifically at diabetics, and it compared diabetics who had weight loss surgery versus diabetics who did not have weight loss surgery. And the bottom line is that they had a significantly less risk of having some type of a major heart event, like a heart attack or heart failure. And some of these findings were really remarkable as far as how much it actually reduces the risk of these things.
And is those risks are reduced because these people are losing a lot of weight, right?
That's correct.
Right.
Yeah.
Okay.
So, and they not just losing the weight, but keeping that weight off. And so that was one of the really great things about this study. It followed patients out for up to 8 years after their surgery. And so we saw not just the short-term benefits of the weight loss, but the sustained weight loss and the sustained benefits of that weight loss.
What do you recommend to people that are thinking about surgery, and why would you tell someone who is obese to get this surgery? Why can't you say, hey, just go to a gym, just eat better?
Sure.
Why is surgery a solution?
Well, two reasons. Number one, it's important for everyone to understand that this is a disease. It's a disease we don't understand very well. We don't understand really what causes the disease, but it's a disease of the excess body fat content and the effects that that has on all the other systems in your body, like your heart and your kidneys and your blood pressure and things like that. And then the other aspect of this is the reason we do surgery is because surgery works. It's really the only solution for patients once they have reached a certain weight that actually has been shown to lose a significant amount of weight and keep that weight off in such a way that it's going to improve their health. And that's why we do the surgery. We don't do the surgery to make people look better, although oftentimes they do, but we do the surgery because it drastically improves their health.
Yeah, so they're not going to die, essentially. And you were saying real quick, why is this surgery safer now than it was maybe in the past?
So many things have happened, you know, from that point of view, and that's really, of all the things in my career that I've seen the complication rates of the surgery go down tenfold during that period of time in the last 20 years. It's actually safer now to have weight loss surgery than it is to have your gallbladder out. And we have new techniques now that are even less invasive or more effective. And so there's a couple of new procedures or procedures that we're doing more commonly now, a procedure called the duodenal switch, a procedure called the endoscopic sleeve gastroplasty, which our group does. And those procedures can either be more effective or can allow patients to have the benefits of surgery but have less recovery time and less risk overall.
Yeah, definitely things are getting better. Dr. Scott, thanks so much for coming in. We really appreciate it. And for more information on HCA Midwest Health, go to kctv5.com/HCA Midwest.
Cons. Adolescents were significantly more likely than adults to have remission of type 2 diabetes and of hypertension. 3 adolescents and 7 adults died in the 5 years after surgery.
I'm glad I did it. I don't regret it.
Penny Wheeler loves feeling lighter on her feet and healthy again. Gastric bypass surgery allowed her to hit her targeted goal of weight loss. Penny says her weight began to soar after a successful fight against cancer. At her peak of 330 pounds, all dieting solutions had failed, and doctors gave her a dire warning.
If you don't have the surgery, you will die within a year. And that was an eye-opener right there.
Mayo Clinic gastrointestinal surgeon Dr. Michael Saar performed a Roux-en-Y procedure. He explained to Penny it would decrease the amount she could eat as well as the length of intestine where food is absorbed. He also explained it would not all be smooth sailing.
Like Dr. Saar said, I'll do the surgery, but you have to do everything else afterwards, which I did.
Regular exercise is a must. She also had to make radical changes to how and what she eats. Some changes dictated by her newly sensitive digestive tract.
Milk gets me sick. You know, like I was not lactose intolerant before the surgery, but I am now.
Vitamins and calcium supplements are now necessary to fill nutritional deficits. Patients on heart medications or immunosuppressive drugs need to be monitored more closely. Dr. Saar says nearly half his pre-bypass patients struggle with depression, and even successful weight loss can create emotional strain.
Spouses may have trouble. You know, you get comfortable with your spouse, and then one of them loses weight and the other doesn't. There can be some jealousy there. They may lose some of their friends.
Scarring from Penny's bypass contributed to an intestinal blockage which required follow-up surgery. But Dr. Saar says there are major benefits as well. Diabetic patients often see their insulin usage or medication needs drop dramatically. Likewise, high blood pressure becomes easier to control.
We expect 80% of people to decrease the amount of medicines they're on, 50% to get off their antihypertensive.
For Penny, the benefits were life-saving and life-changing.
I'm very happy.
I'm Dennis Doda, reporting for Medical Edge on the Mayo Clinic News Network.
You should apply in Ecuador. Actually, this producer is successful in many parts of Ecuador. Conclusion. Adolescents and adults who underwent gastric bypass have marked weight loss that was similar in magnitude 5 years after surgery. Adolescents have remissions, diabetes, and hypertension more often than adults. Thanks for your attention.